Morning, everyone. Thank you for being here this morning. There are a couple of important things to visit with you about today. I want to start with something that is certainly top of mind for many of us right now, and that is the coronavirus 2019, also known as COVID-19. Right now, according to the CDC, we know that a little over 83,000 people are confirmed reported cases of this respiratory illness globally, and nearly 60 in the United States. As you know, tragically, COVID-19 has claimed the lives of more than 2,800 people worldwide, although none of these deaths, fortunately, have been in the U.S. Here in Missouri and in the city of St. Louis, we're fortunate that so far we have had no confirmed cases of coronavirus disease 2019. That doesn't mean that we aren't intently, though, monitoring this developing public health situation and working with our community and medical partners. And so I want to turn this over right now to Dr. Fred Eccles, who's the director of our health department, who's certainly best equipped to visit with you about this. So with that, I'll turn this over to Dr. Eccles. Thank you.
Thank you, Mayor Friesen, for that introduction and your brief remarks. Health agencies across the world are responding to an outbreak of respiratory disease caused by coronavirus, or novel coronavirus, which essentially is a new coronavirus that hasn't been seen before, which was detected in Wuhan City, Hubei Province, China, which has now been detected in over 50 locations across the world, including the United States. The initial name of the virus is SARS-CoV-2, and the disease that this particular virus causes is called coronavirus disease 2019, abbreviated COVID-2019. Although imported cases of COVID-19 in travelers have been detected in the U.S., no cases have been reported in the city of St. Louis or the state of Missouri. The City of St. Louis Department of Health is working closely with local, state, and federal agencies to ensure proper awareness and timely implementation of control measures in the event a COVID-19 case is detected in the city of St. Louis. All persons returning from areas impacted by COVID-19 are being monitored according to protocols established by the Centers for Disease Control and Prevention. We have an amazing group of communicable disease staff conducting this work along with infection preventionists at local health systems and communicable disease staff at the Missouri Department of Health and Senior Services. Furthermore, the public health and medical communities are diligently working together to better understand the complete clinical picture with regard to COVID-19. For the health department, in order to obtain more information about the plans that were present in the St. Louis region, in early January we held a meeting at the City of St. Louis Department of Health. During this meeting, we included staff from the Lambert Airport, St. Louis County Department of Public Health, law enforcement, health systems, and fire and EMS. And the goal was to make sure that we all understood what the plan would be in the event that a COVID-2019 case was identified in our region. Having this meeting properly prepared us to, one, ensure that we're aware of the different protocols that will be implemented across the St. Louis region, and to ensure streamlining of processes and communication across all departments that will be involved. While the immediate risk of this new virus to the American public is believed to be low, at this time, everyone can do their part to help us respond to this emerging public health threat. One is currently flu season and respiratory disease season. So the CDC and City of St. Louis Department of Health recommends getting a flu vaccine. You can also conduct everyday preventive activities such as avoiding close contact with individuals who are sick, avoiding touching your eyes, nose, and mouth, staying home when you're sick, covering your mouth when you cough or sneeze, clean and disinfect frequently touched surfaces, washing your hands with soap and water often, and if soap and water is not available, use hand sanitizer. If you are a healthcare provider, be on the lookout for people who recently traveled from China and have fever and respiratory symptoms. In addition, you should also be mindful of individuals who may have come into contact with individuals who have had contact or been exposed to another person who is confirmed to have COVID-19. If you're a healthcare provider caring for a COVID-19 patient or public health responder, please take care of yourself and follow recommended infection control procedures, which are available through the CDC. If you have been in China or have been exposed to someone sick with COVID-19 in the last 14 days, you will face some limitations on your movement and activity across the city of St. Louis. Please follow instructions during this time. Your cooperation is integral to protecting the health of St. Louis area residents and visitors. If you develop symptoms, if you develop COVID-19 symptoms, contact your healthcare provider and tell them about your symptoms and your travel exposure or exposure to a COVID-19 patient. Giving your medical provider a heads up allows them to ensure that they limit the exposure to others that may be visiting their facility. The risk of getting COVID-19 in the U.S., again, is low at this time, due in part to the public health infrastructure that has been established over decades. However, individuals with fear and anxiety can oftentimes lead to social stigma towards Chinese or other Asian Americans because of the initial location where the condition was identified. As we all know, stigma and discrimination may occur when people associate an infectious disease, such as COVID-19, with a population or nationality, even though not everyone in that population or from that region is specifically at risk for the disease. An example of that would be Chinese Americans and other Asian Americans that are living in the United States. People, including those of Asian descent who have not recently traveled to China or been in contact with a person who is confirmed or a suspected case of COVID-19, are not at greater risk of acquiring or spreading COVID-19 than other Americans. The City of St. Louis Department of Health takes its mission very seriously. We will continue to work with local, state, and federal partners to ensure we're doing our very best to protect the health of St. Louis area residents and visitors. If you need additional information or have questions about COVID-19, please contact the City of St. Louis Department of Health, and we'll be posting a frequently asked questions document to the city's website later today.
Thank you all. I have a couple of other subjects to visit with you about. First of all, and most of you know this, yesterday I signed Board Bill 200 into law, and that is a pay bill for city employees that was sponsored by 14th Ward Alderman Carol Howard, passed out of the full board 26-1, and makes competitive merit-based pay increases for full-time civilian civil service employees. On their anniversary date, they will, instead of getting a 1.5% raise, their raise will be increased to 3%, this merit-based raise. City employees are, of course, our most important asset, so it's imperative that we're able to hire, train, attract, and continue to attract this dedicated group of civil servants from who keep us better, from patching potholes to working in our health department to accountants to IT folks. So as most of you know, we have a number of openings in the city, almost 700 permanent openings as of today, and an additional 300 seasonal employees that we're beginning to hire. That's grass cutters, folks who work in our parks, and folks who help us keep our city good. So any of you who are aware of folks who need jobs, now is the time to apply for those jobs. As you know, a bit ago, I increased the minimum pay through executive order and working with the personnel department to $15 an hour. We think that makes these jobs much more attractive. The city's a great place to work with good benefits, health insurance, retirement plans. So this is our pitch to all of you in order for you to pass the word that we do need good city employees. We also, as in the prior year, have STL youth jobs, which are jobs for young people 16 to 24 years old. We are beginning to take applications for those jobs right now through the STL Youth Jobs website. So that has been expanded. We expect to hire 1,000 young people this year through STL Youth Jobs, and we know that there's nothing better for a young person to have that pride in a job well done and have their own money in their pocket. It's a great learning experience. We had an STL Youth Jobs individual last summer in the office here working with us. She was a great asset, and I think that all of you would find an STL Youth Jobs young person great in your workplace as well. And with that, Dr. Eccles and I are both happy to take questions.
Mayor, regarding the pay bill related to the rental leave bill that's pending over the Board of Aldermen, right now I think it's just would apply to exempt employees, although the sponsor of the coalition is trying to figure out a way to expand it. What's your position on that? Can the city afford it? I don't know what the fiscal is.
You know, of course, we want people to be able to take time off when they have a baby, adopt a baby, or need to care for a family member or themselves. I think that bill is not finalized at this point in time, and we've been working with the sponsor to get that bill to a point where it would be something that would be effective for the city. There's already Family and Medical Leave Act, which is 12 weeks off. The city also has sick pay, and it also has vacation time. So I think the coordination of those things is important.
How about the expense to the city if that bill is passed? Is that a concern?
One of the things that we've asked for is a fiscal note on this bill. Sure.
Mayor, on the jobs thing, are you going to have active outreach efforts, especially in this really stressed neighborhoods of the city?
Absolutely. We do a number of job fairs every year. Yes, last year I was at I think 3 job fairs that we did at Wohl Community Center. We've also doing them around the city. We'll continue to do them. This year we're just getting those dates and times planned, but we're trying to get the word out that there are permanent jobs, almost 700 permanent jobs. You name it, we need it. We need accountants, we need IT people, we need people to help pick up trash, we need grass cutters. We have openings in all areas. And of course, you know we're 152 police officers short. So there are openings in every job category. Great place to work. Help out your community.
Mayor, is the lease probably dead at this point? The Bi-State Board doesn't look like it's going to reconsider based on your request. I talked to the St. Clair County Board Chairman at East West Gateway the other day. He told me he's not going to ask his commissioners to look at it unless Sam Page wants to. Sam dodges the question basically. So, I mean, what's your view on it now? Where it stands?
I think I'll work in any way to avoid having a $25 million payback to the federal government, and that's where we are right now. So my position has been clear on this, which is that we need to take this project and make it viable, but I don't know if that's going to happen at this point or not.
Options other than the Bi-State plan?
There are folks working on those options because, frankly, we don't want to pay back $25 million. And
What are some of those options? Can you elaborate?
they run the gamut.
Does one of them involve the city kicking in some more money to it, or something?
I think that's doubtful. The city puts in 100% of all the money that we collect for transit. The county, as you know, does not, but I understand that this is a political question, but for me, it is more about what's the right thing to do. And I think the right thing to do here is to do everything we can to avoid having to pay back $25 million.
The bottom line is, in your view, it's not dead at this point. You're still...
I can't answer that question. I think the responsible thing to do is to do everything possible not to have to pay back $25 million and incur the black eye that would cause on our region, not on the city, not on the county, on our region with regard to federal applications for federal funding.
Any coronavirus questions?
One, maybe for the mayor or Dr.
Sure.
Eccles. I think originally people were wondering if this virus would burn itself out or if it might be contained to Asia. So has your understanding about the virality or the the potential spread of this change since it kind of came on the scene late last year?
Absolutely. So the potential spread is spread. So it's international. It's across the world now. And so essentially what we'll more than likely see is a recurrence of what happened with H1N1 years ago, where initially it was seen as a novel virus, but then it became a part of the group of viruses that we typically see annually. And so as you know now, the H1N1 is a part of the flu vaccine that individuals receive every year. And so more than likely this may happen. A similar situation may occur.
How are you able to track people who have been to affected areas or have been with people who have been to the affected areas?
So we work really closely with the State Health Department. So the Missouri Department of Health and Senior Services works really closely with the CDC, and they have a division called the Global Migration and Quarantine Division, which tracks individuals coming from affected areas. And so before an individual actually arrives into our jurisdiction, we know who they are and we know how to contact them. And so upon their arrival within our jurisdiction, we monitor them for 14 days according to the CDC protocol. If they develop symptoms during that time, we have other mechanisms in place to make sure they are linked to appropriate care and they receive appropriate treatment.
How many are monitoring at this point, do you know?
So the total that has been monitored across the region has been over 20. But again, no one has tested positive for coronavirus, and so at least for novel coronavirus. So at this point, the potential for spread within the St. Louis region is low.
By region, what do you mean? Metro East included, or just?
Yes, Metro. Yes.
Doctor, what was that number you said? I didn't pick it up.
Is it over 20?
Over 20, okay, so I thought so. Thank you.
And so they're all in a protocol now, basically, those 20 people?
So no, that's the total that has been monitored since the monitoring has begun. And so again, I just want to make sure that everyone knows that the protocol is for us to monitor them for 14 days. If they meet the criteria for testing, then they're screened according to CDC protocol. And again, no individual that has been monitored has tested positive for coronavirus or COVID-19.
Just to clarify, some of the 20, they've gone through it already, some are doing it now as a mix?
Correct.
Okay, and then when you say region, you mean St. Louis metro area, the specific?
That's correct.
Just wanna be sure.
Yes.
Dr. Eccles, I think everyone's hearing about this in the news and they're pretty concerned. Is this virus more deadly, or should people be more concerned about this than, say, like the common cold or the flu?
That's an excellent question. So the fact that no one has screened positive for coronavirus, the most likely cause for respiratory symptoms would be seasonal flu or seasonal influenza or other respiratory virus such as respiratory syncytial virus or parainfluenza virus that commonly causes respiratory symptoms during this time. And so we ask providers as they are engaging with their clients and their patients that they really be mindful of the most common causes of respiratory symptoms during this time of year and to create their differential diagnosis based on that.
What kind of help are you getting from the federal government?
The federal government has actually helped us prepare for where we are today. So through our Public Health Emergency Preparedness Grant, we're able to have emergency operations protocols in place to ensure that in the event that we have a significant event that poses a threat to the public, we're able to mobilize resources and staff in a timely manner. Without the Public Health Emergency Preparedness Grant, that will be very difficult to do. And so they've helped us to develop the infrastructure, not just for the city, but for the region. In addition, we have really great support from the Missouri Department of Health and Senior Services, and they receive direct support from the Centers for Disease Control. So a lot of our communicable disease investigation protocols, surveillance protocols are passed down from the CDC, and we're implementing those.
What have you done with hospitals and other care providers to make sure that if somebody does present, it doesn't spread?
So we work really closely with infection preventionists across the health systems. So when a person is being monitored, we make sure that there's a designated hospital where they would like to go. We make sure the hospital is informed. But oftentimes the initial screening is done at the hospital. And so we work really closely with infection preventionists and care providers at local health systems across the region as well.
Mayor, unrelated question. Yesterday, you need to be aware there's 27 Republican state legislators from across the metro area said they announced they're going to support a bill to make elections in the city for municipal offices nonpartisan. What's your reaction to that? Do you have an opinion either way?
I heard that yesterday, that there were a number. I did not know that it was 27. I think let's wait to see what really happens with that bill. So at this point in time, I think our elections are working just fine here, and we'll wait and see what happens with that bill.
So you're not gonna take a position at the moment?
I'm not. I think what we're doing right now works fine. And I think what we have to look at is, well, what is their motivation for changing that with the city of St. Louis?
What do you think the motivation might be?
I don't know. I'm not going to impute anything to them.
We can do about 2 more questions, guys.
Mayor, I also have a question about a bill. It was introduced and it would replace marriage licenses with domestic unions. Do you have a position on that?
Ridiculous. You know, I am. There are a number of bills in MOLEG that are really aimed at the LGBTQIA community. I don't know why they are spending their time worrying about that. These bills are hurtful. The LGBT community, they are our friends, they are our neighbors, they are our family members. And I don't see anything that lifts up the people that we're all supposed to represent in those bills.
One more? Oh, come on.
I have a question.
Okay, great.
So, about a bill that was recently introduced that would decriminalize Syrian distribution among certain nonprofits around the area and care providers. And I know that there was originally a bill that would establish Syrian services programs, and that seems to have stalled. Do either Dr. Echols or Mayor Creason, do you have any opinions on why that might not be going through the process? I talked to the bill sponsor who said that it had sort of hit some roadblocks, and this new bill is remedy to that.
So the risk reduction is an important part of HIV prevention and prevention for the transmission of bloodborne pathogens. When we're implementing bills, we also have to make sure that we're mindful of state statutes. And so we have to make sure that we aren't putting ourselves in a position where we will violate state statute. We have to work really closely with the state. We value our partnership with the state, and we don't want to do anything to jeopardize that. And so prior to implementing a bill that would violate a state statute, we have to have really fruitful discussions with our partners at the state level, and also make sure the community members understand the position that the health department and the city government is in at this point.
So the original bill violated state statute, at least there's some people interpret it that way?
Yeah, so according to the state statute, so syringes it's a component of drug paraphernalia. And so the way that the bill was initially written would allow us to provide syringes to individuals in exchange for dirty needles. And so because it violates the state statute, that puts us in a very peculiar situation. So we try to.
The new bill does what? I saw it, but
So before an additional bill is introduced, we have to have meaningful discussion with our state partners to make sure that everyone is on the same page, because again, we don't want to do anything to jeopardize our relationship with the state.
there was a new bill introduced, though. The health department's holding off supporting or that for now. Is that where you're at?
Well,
Because you were supporting the original bill, I understand. You helped write it, I think. I don't know you personally, but you're on.
so numerous people were involved in drafting the language for the first bill. For this second iteration, it wasn't properly vetted by the health department or other city government officials. And so, again, before it was introduced, we didn't have a chance to look at it.
Reviewing it. Okay, thank you.
Okay, guys, we have a handout from the health department about bullet points on coronavirus, and
So we'll be sharing this FAQ. It'll be posted on our website. We'll also provide a copy to all media outlets that are present today. And this information will also be shared with local school districts as well as religious organizations.
cool. Thanks, everyone.
Thank you all.
Dr. Kaiser.
I think we should actually tweak this one too. I still haven't figured out who that state rep was that introduced that bill. I think but they didn't do it the county.
I think we have spoken occasionally on stand in for